you can see very deep arcuate cuts, especially this one. That's called the aphasia along with extreme farsightedness of about 9 diopters. That patient had previous PRL and ICL removal in Sweden. Here we are. I'm feeling up a lot of the scar areas to the western side, which was really positive. Good.
Disco.
Lovely. Thank you. Doing very well. I feel you comfortable?
Yeah, we're
Super. For doctors watching, and I'll be teaching about this as we talk. I'm in your eye. Any pain at all? Excellent. If the doctor is watching, you see they're being very finicky that the mark exactly comes to the corneal mark here, the toric mark here, and these are his large, extensive astigmatic keratotomies that he's had in Sweden with repeated ICL, PRL surgeries. Excellent. So here we are about to finish up in this wonderful gentleman. He's actually an anesthesia doctor in Sweden, right, Michael?
exactly.
Wonderful. And he's traveled here. He's had multiple ICL, PRL surgeries, and they were all removed. And what we are doing here is LenzOplastique to correct his extremely high farsightedness and very high regular astigmatism, because they made very deep arcuate cuts, as I showed you, in the cornea. And we are being very finicky. Michael, I'm in your eye. You have no anesthesia other than numbing drops. Any pain at all?
No, nothing.
Super. Comfortable?
Very, very.
Wonderful. He's a wonderful gentleman, actually from the medical professional, like I said, in Sweden, and he has traveled here. And we are in his eye, as all our patients, no anesthesia other than numbing drops. Polish? Wonderful. So here we are, finishing up. You can see the capsule is properly polished. There is a perfect toric mark matching the corneal toric mark, and you can see these very deep arcuate cuts that have been made here previously in Sweden, and we are conquering that with extreme hyperopia, +8 and +9 in this wonderful gentleman. And Michael, anything you want to say about your experience? I'm still in your eye.
It's feeling good, secure, and good. Feeling.
Congratulations, safe travel back to Sweden. Been a pleasure, Michael.
Thank you.
Wonderful. Coming out. You can see his pre-existing large arcuate cuts here and here, causing ectasia, very high regular astigmatism, and extremely far-sighted eye with +9. And that's the placement of a toric thinking technology, right on axis, being very finicky, perfect coverage of the capsule by 1-2 technique, dot technique. And we have hydrated the incisions in between the cuts. And he's a wonderful gentleman. And Michael, anything you want to say? He himself is an anesthesia doctor from Sweden. Anything you want to talk about your experience since you've been through many surgeries before coming here?
My thing is that your team here is very professional and you listen to me. That's my problem is, and you can tell me that, I can see that you have problem and listen to me. Yes.
My pleasure.
Very good.
Absolute pleasure. So surgery is all done, and as usual, for all doctors watching, there is no anesthesia other than numbing drops, right?
Exactly.
These are all done. So Michael, we are all done. How do you feel?
I feel very good today, and I'm very happy to be here. And it's exciting, and you have been a good doctor and support, and all the team, of course.
Pleasure.
Very good.
For doctors watching, you saw this wonderful gentleman. He is actually anesthesia medical in Sweden, and he's traveled here after previous multiple ICL, PRL surgeries. Very high farsightedness, very high regular astigmatism. You saw the cuts on his cornea with ectasia. And we did a LenzOplastique surgery, and you saw me being very finicky with the premium toric technology. Like all our patients, there is no anesthesia other than numbing drops, not even Valium drops.
No.
Anything you want to say about your experience? Because you deal with patients all the time in Sweden yourself.
No, I mean, it feels very secure and calm, and step by step you took me through this whole time.
Sure.
From the beginning when I come, my first step in is like.
Sure. And even though this is very complex surgery, can you tell anything at all?
Tell? You mean see?
Yes.
Yeah, of course, I can see everything.
Yes?
but it's a little bit
Sure.
dizzy. But I can see everything.
Amazing.
Yeah, that's amazing.
Well, Doc, congratulations.
Thank you
It was
very
a
much.
pleasure.
Thank you.
Here he is, the man from Sweden. Anna. And no stretcher. Anna, can you believe it? Come forward, please, Doc.
Right
here, yeah?
Yeah.
How do you feel?
I feel very good. I feel like I can surf.
You can serve no.
No, I'm just kidding.
And
But I have to have my head up like this all
Yes.
the day.
Yeah.
That's,
Mainly, I haven't taken a stitch, so no pressure on the eye. And for doctors watching, it's an amazing. Actually, he works as a anesthesia physician in Sweden. He's come with multiple complications. They've done ICL, PRL surgery for his very high farsightedness, and also he has very high astigmatism from all his cuts that you saw in the cornea. And we did the lens-based surgery, LenzOplastique. No anesthesia, as you can see, no drugs other than numbing drops. Any pain?
no.
He's coming out without a stretcher, and again, given how extreme you work, can you tell any difference already? Can you see amazing Anna here?
Yeah,
Anna.
Maybe Anna. Yeah, it's
Yes.
my wife.
You can see her,
Yeah,
the pink dress.
yeah. Think of her.
It's blue.
Yeah, I didn't hear that, I think.
But again, safe travels back to Sweden. Been a pleasure.
Thank you
Come
very
this way,
much.
please. Good morning, doctor. How are you?
I'm fine. How are you?
Seeing already?
Yeah, good. Thank you very much.
My pleasure. Thanks.
Good.
So again, Doc, you've seen, you guys all stalk me, see all these videos before coming here, right?
Yeah, exactly.
How does it feel being part of it today?
It's great. I'm very grateful, and I'm very happy. I'm traveled from Sweden all long and save a lot of money. Maybe I shouldn't say, but I have struggled a lot with my left eye after several ICL operation in Sweden, and finally the doctor in Sweden told me, we can't help you. We can't help you. So now I finally, after a lot of research on the web, I met Dr.Gulani, and he helped me a lot, and I'm very thankful for that. And today I have no pain and I can see, and in Sweden I had the problem that the doctors, if they didn't know what to do, and they told me you can't do anything, and then they say go and never come back. And even the doctor, he was angry at me, and you can't come here and say that you have pain. You have no pain, but I had pain. No, Dr. Gulani listened to me, and that's very nice, and it's very good and makes me happy.
My pleasure. For doctors who are watching, we are doing this every day here, Michael, to encourage with my colleagues all over the world. And all of you are real people coming from far, far away here, and how we are solving the problem. And then what I call the highest accountability, since you are also from the medical field, highest accountability is the patient on camera. So doctors, this is day one. This is a wonderful gentleman, himself an anesthesia doctor in Sweden. He's traveled all the way, had multiple complications of ICL surgery and PRL surgery, which were both for women, right?
Yeah, exactly.
And when he came here, we looked at his scenario, and he had multiple surgical issues in the eye, but also had very large cuts. You can see here, if you come closer, these large arcuate cuts on both sides, which were causing over 9 diopters of irregular astigmatism, along with 9 diopters of farsightedness in him, and you can see the peripheral iridectomy that has been done. So we took this patient with that very high flat astigmatism, you can see, because of the arcuate cuts he had, and of course he's very farsighted, +9. And we corrected that with intraocular surgery. This is day one today. You can see the lens implant in place. It's a high toric lens placed in my corneoplastique concept of access. We are correcting farsightedness and the irregular cornea through a lens-based surgery. This surgery was done like all our patients without anesthesia, with just numbing drops, right, Doc?
Exactly.
Any pain? You didn't even have a Valium, any pain at all?
No pain at all.
So all these patients don't take anything, and I'm in their eye and we are chatting as we do surgery. And how would you rate your experience from yesterday?
Yeah, I feel very secure because when it was like going into the airplane when I come into the operation, like some cross-check report feeling, like the pilot says, and you told, and all the team was focused, and you have a good communication. And Dr. Gulani says all the time, "It's going good, Mike, good," and he told his team that it's going good. Even if it doesn't go good, but it did this time, it's exactly. It's, you have to feel like when you're lying there without medication, you have to.
And that's a very important point coming from him himself, being a doctor of anesthesia in Sweden. Very important point is being secure. Doctor is very important. I knew his history, that he had been through a lot of trauma in his previous surgeries, so he was expecting pain and trouble, and that's why it's so important to be in touch with him during surgery. It's a great point, teacher point, wonderful. Anything else, Anna, you want to say as his wife who came all the way from Sweden with him? Anything you want to say about your experience here and what he's been through?
I'm just glad finally he could come here. It's been a few years of research and going through all this, trying to go to the doctors in Sweden, and a lot of disappointment on the road. So finally he came here, so I'm very happy for that.
Doctor, congratulations. Safe travels back.
Thank you very much.
Absolutely.
Thank you.